So, have you ever actually stopped to think about what connects your spine directly down to your legs? Like, what's that hidden architecture inside your body that keeps your core totally stable, but still lets you walk, run, sit up, and bend over? Well, today, we're going to answer exactly that by exploring a super important group of structures known as the posterior abdominal wall muscles.
Welcome to The Explainer. I am so excited to have you here. If you're a focused learner looking to really master human anatomy without all the extra fluff, you are in the exact right place. Today's Explainer is a complete visual guide to these posterior abdominal wall muscles. We're going to map out these deep, stabilizing cables so you know exactly how they work, why they matter, and what they actually do.
Okay, let's dive into this. Here's our roadmap for today. First, a quick overview, then the psoas major, the iliacus, the psoas minor, and finally, the quadratus lumborum.
Section 1. The posterior abdominal wall. Think of your abdomen like a giant room inside your body. Right now, we are looking at the foundational back wall of that room. It's heavily supported by your central bony column, anchored right at the bottom of your rib cage by the 12th thoracic vertebrae, or T12 for short. And right below that, you've got all 5 lumbar vertebrae, L1 through L5, plus those shock-absorbing intervertebral discs sitting between them. Basically, this bony spine is the central tent pole for the whole shebang.
So what's actually attached to this tent pole? Structurally, we're looking at 3 or 4 pairs of muscles. And yeah, I did say or 4, for a very specific, kind of wild evolutionary reason that's going to surprise you in just a bit. Functionally, almost all of these, except for one, actually belong to the anterior group of your pelvic muscles. Teaming up, they form this thick, protective, and highly active padding right along the back of your abdominal cavity.
Section 2. Psoas major, the spine connector.
Let's meet our first real powerhouse here and see how it builds your core strength. Notice that long, thick muscle right there? It stretches down each side of your lumbar spine, runs all the way from your lower back, crosses straight through the pelvis, and attaches directly to your femur, your main thigh bone. It is literally a muscular bridge linking your upper body right to your lower body.
Let's break down exactly where this bridge is anchored. You know, in anatomy, muscle attachments are called origins and insertions. The psoas major has a superficial origin on the lateral sides of vertebrae T12 through L4, plus a deeper origin on the transverse processes of L1 to L5. But here's the cool part. All of those complex spinal anchors funnel down into one single, vital insertion point, the lesser trochanter of the femur. Think of it like a massive suspension bridge with tons of cables up top, all pulling down to one massive anchor at the bottom.
Now, what does this incredible connection actually do? Its main job is the flexion and external rotation of your thigh. Basically, it's what lets you lift your knee up towards your chest. But here's where it gets really cool. If your leg is firmly planted on the ground, this muscle reverses its kinetic chain and flexes your trunk forward. It's literally the muscle yanking you up when you do a sit-up. And because it connects your legs to your spine, sitting at a desk all day can make it incredibly tight, which, by the way, is a huge hidden cause of lower back pain.
Of course, every machine needs wiring and plumbing, right? The psoas major gets its electrical signals from the anterior rami of the lumbar spinal nerves L1 through L3 via the lumbar plexus. As for the plumbing, its blood supply, it's richly fed by the lumbar branch of the iliolumbar artery, the lumbar arteries, and the deep circumflex iliac artery. Gotta make sure this massive workhorse never runs out of oxygen.
Section 3. Iliacus, the pelvic anchor.
Now, what's really fascinating about this next muscle is how it teams up perfectly with the last one. The iliacus is this flat, distinctly triangular-shaped muscle. See how it flawlessly lines the inside of the pelvis? It essentially fills up that bony bowl we call the iliac fossa. It's nice and wide at the top to distribute the load, and then tapers down as it heads toward the leg. And this brings us to a massively important concept, the iliopsoas muscle. Even though the psoas major and the iliacus start in completely different places, one way up on the spine, the other resting down in the pelvis, they actually merge together physically as they cross the hip joint. They join forces to become the iliopsoas, acting as one incredibly powerful mechanical unit. Let's map out the iliacus, specifically. Its origin covers a really wide flat area, the iliac fossa, the internal lip of the iliac crest, the lateral aspect of the sacrum, and nearby sacroiliac ligaments. But if you look closely at the insertion, you'll see it shares the exact same finish line as the psoas major, the lesser trochanter of the femur. So 2 completely different starting lines crossing the exact same finish line. And because they shared that finish line, the action of the iliacus perfectly mirrors the psoas major.
It powerfully drives the flexion and external rotation of your thigh. Plus, just like its partner, if your leg is solidly anchored, it pulls from the bottom up, actively participating in trunk flexion. Together, they are the absolute dynamic duo of your core stability.
Quickly covering its life support network, the iliacus gets its electrical commands from the femoral nerve, specifically roots L2 and L3. For blood, it relies on the iliolumbar artery, along with branches from the femoral, obturator, and deep circumflex iliac arteries.
Okay, here's where it gets really interesting. Earlier, I asked if you had 3 or 4 muscle pairs in your posterior abdomen. Well, get this, nearly 60% of you watching this explainer right now don't actually have this next muscle. It's basically an anatomical wildcard.
Meet the psoas minor. It's a really long, surprisingly slim muscle that sits right on top of or anterior to the psoas major. But like I said, it is totally variable. We only see it in about 40% of the human population, so if you don't have it, don't sweat it, your body has evolved to work perfectly fine without it.
For the 40% of you who do have it, its origin is way smaller than the major, just the lateral surfaces of the T12 and L1 vertebrae. And instead of going all the way down to the femur, it stops early, inserting right into the pelvis at the iliopubic eminence. Since it's so small, its action is pretty minor. It just helps stabilize the pelvis and hip joint a tiny bit and aids slightly in trunk flexion. Oh, and it gets its signals from the L1 spinal nerve.
All right, section 4. Quadratus lumborum, deepest stabilizer.
Let's look at our final structural pillar. The quadratus lumborum lies deep in the abdomen, entirely posterior or behind the iliopsoas group we just talked about. It's literally the absolute deepest muscle of your posterior abdominal wall, acting as the ultimate structural backstop for your entire torso. Let's trace its anchors. It originates down at the bottom, on the iliac crest and the iliolumbar ligament. From there, it reaches upward, inserting into the transverse processes of your L1 through L4 vertebrae, and stretches all the way up to connect to the inferior border of your 12th rib.
Because of those unique attachments to the ribs and the spine, its action is absolutely crucial. If both sides activate together, which we call bilateral activation, the muscle actually depresses and stabilizes your 12th rib. It essentially ties down your rib cage when you're taking a deep breath and also helps extend your trunk backwards. But if only one side fires, unilateral activation, it gives you lateral flexion. That's exactly what allows you to bend perfectly sideways. So yeah, it's incredibly important for your posture and lower back stability.
So how well is your hidden architecture supporting you today? We've covered a lot of ground, so let's quickly hit those main takeaways. 1. Your posterior wall is supported by your lumbar spine and basically 3 or 4 distinct muscle pairs. 2. The psoas major and iliacus join forces to form the superpowerful iliopsoas, which is the ultimate bridge between your spine and your legs. 3. The psoas minor is this fascinating anatomical wildcard that more than half of us don't even have. And 4. The deep quadratus lumborum stabilizes your lowest rib and lets you bend sideways. I really hope this look helped you map out these incredible human structures. If you enjoyed this explainer, please hit that subscribe button for more simple, visual medical explanations. Keep learning, stay curious, and I'll catch you in the next explainer.